welcome one and all to Just Massage Therapist podcast, where we are just massage therapists. These are just our opinions, and yeah, we're gonna chat. We're just gonna chat about stuff. Uh, I gotta press the Instagram go live before we. There we go. The Instagram go live has been pressed. There we go. Yeah. Okay. Woo!
We're live.
We are officially alive. Alive. Oh my gosh, so fun. So yeah, if you are joining us on YouTube and or Twitch, we'll be able to see your stuff right in the chat where we are. If you are joining us from Instagram, we will have to go back and forth. So if you do say something and we don't catch it right away, it's just because I haven't come and looked at it, and that is okay. Just give us a second, and we will be able to come and chat with you. If you are watching this later on because you do not want to watch us at 9:30 in the morning, totally get it. Uh, then welcome. Say something in the chat. Say hi. We love to chat with you guys. Hey Cora,
Chelsea,
what are we talking about today?
scar tissue.
Oh yeah. Hmm. I love
Good
scar
old
tissue.
scar tissue.
I do
Bitters.
love it.
It's so bittersweet.
It is. It is. Uh, I even from a really young age, I loved scar tissue. I have, as far as visible scar tissue, I have so many visible scars, specifically on my hand, from one particular bunny rabbit and about 80 different cats. So many cats. I have one really nice, you won't be able to see it, but one really nice long one right here from Bagel the bunny, who hated me,
Mm.
loved my mom, loved my sister, hated me, hated my dad. I don't know. I think I hated my dad because my dad was basically like, I don't, why did we get this thing?
Fair enough.
I think hated me because I was the youngest and I was kind of handsy.
Fair enough. That works.
Yeah, but yeah. I've got some great little scars, and then I've got really wonderful three scars down here from a cat I was also a little handsy with.
Yeah.
I was a handsy little kid.
It's a thing. It's a thing.
It was a thing. What about
See?
you? Do you have any really cool scars?
Well, I have a scar on my hand from, well, it's both on my hands from my hedgehog. She was a biter.
Yeah, hedgehog. That is not. It's I. Nobody expects to hear hedgehog.
Yeah, definitely a hedgehog. Yeah, she was really ornery. And I used to have to wear like those big rubber dish gloves in order to handle her because she would like ball up. But yeah,
So Amy the hedgehog. Obviously, I don't know what her name
well,
was,
her
but I
name was
think of Sonic.
August actually. So
Oh,
another.
that's so funny. I was gonna make a joke about Sonic, but then you said she, and I'm like, oh, Amy, who's
She
Sonic's.
was my. She towards the end though, she was my buddy. She used to like sit here and we'd like watch TV, and she just like cuddle me.
That is adorable.
Yeah, we
I
used to
love
like
that.
go into the raspberry bush, and she'd like catch the bugs, and I just like she used to hang out in there sometimes, and then that was actually her downfall, though, because she got away from me. She got into the neighbor's yard, and then that was the last of her. That was it. Never saw her again after that. It was a little bit traumatic for me. I'm sure she hopefully was able to enjoy sometimes before the cats got her, but we tried to get
Yeah.
her back. We tried. I
Wow.
learned a lesson that day.
That would be a lesson to learn.
Yeah.
I'm so sorry you had to learn that lesson that way.
Oh, that's a thing.
Definitely a thing. Whew. Yeah, we learned. Yeah, no. Let's not talk about those lessons because we probably have enough of those, and nobody needs to hear those lessons.
Fair enough.
So, Cora, question for you. Another question for you. Are scars only ever shown and felt and stuff on the skin surface from when we injure ourselves or we break the skin?
Oh, definitely not.
No, where else can you find scar tissue?
Anywhere where there's connective tissue or soft tissue, anywhere where it's torn, or the integrity of the tissue is compromised, the
Mhm.
body's going to come in and kind of reinforce the area. We are not built, we are still very much hunting and gathering. We haven't adapted to our current lifestyle. It happened way too fast. So the body is built for stability, and any weak spot is not okay. So scar tissue will be built or any weak spot.
Yep. That's something I feel like not a lot of people truly understand, not just in massage world, but just like in general. A lot of people don't understand that. The fact that if you do have, say, an area that's overstretched or an area that's been damaged with repetitive strain or with a big issue with damage, that scar tissue, it doesn't just fix the area and then go away.
No, it's there forever.
It's there forever. It's like ripping your favorite pair of jeans. You can't just replace the exact same fabric. You have to stitch that area up or stitch a patch on.
Yeah.
Right? If you can just stitch the edges together, it's probably going to be less of an issue and it probably won't get as stressed. But if you have to stitch on a patch around the edge because it's a big hole, if you have to stitch on a patch around the edge, now you have this whole big long edge of seams that could get, and it's not the same fabric,
No, it's not.
right? And that fabric, although it may be a strong fabric, if you keep ripping, you're just going to have to add more fabric.
Well, and also because it is different fabric or different material, that it's not going to work the same.
Nope.
Right. So there's still going to be, even though the scar tissue is strong, it's still going to affect the way that that specific structure works and the way the edges actually fit together. So it's going to create a domino effect. It's not just, oh, I had rotator cuff surgery. This is where the scar tissue is. It's going to extend up into the upper back, up into the neck, down into the arm, and then those reinforcements are going to continue to establish themselves.
Mm-hmm. I like to think of it. I always go with stretchy denim and non-stretchy denim. The stretchy denim being like tendons and subcutaneous uh, fascia and the fascia around like muscles and nerves and stuff. That stuff is stretchy, but
Mm-hmm.
it's strong. It's a strong, stretchy material like stretchy denim. But if you get a hole, you're not patching it with stretchy denim. You're patching it with hard denim, non flexible denim.
Right.
And when you patch that non flexible denim, it's not going to move the same way as everything else around it moves. And because of that, it's going to cause stress points in other areas. And
Mm-hmm.
those other areas might tear. And then you have to patch it with that non stretchy denim because that's the only thing you have available.
Yeah.
The stretchy denim has uh, fabric that is strong and it has fabric that is stretchy, and they work together. Your hard denim, I think of like Carhartts, I think of like work pants, right? It just has the strong fibers. It doesn't have the stretchy elastic fibers.
Stability is key,
Mm-hmm.
especially, yeah, with that.
What's one of the patterns you see the most where you see uh, a lot of scar tissue built up?
I'm sorry, one more time.
Sorry, one of like the areas of the body due to just patterns of living that you see a lot of scar tissue get built up in.
Probably the shoulder and the SI
Yeah,
and the ankle. There's a lot in the ankle.
a surprising amount in the ankle.
Yeah. I really feel like it's because of the change of plane. So, like, because, everything is like
Ooh.
up and down, and the ankle all of a sudden changes, right?
Yeah.
So that, and it's weight bearing. Our ground is not even, and we just walk. We don't pay attention to how our feet are actually maintaining contact. We don't really pay close attention to how we're moving, how we're standing.
Yeah.
I've caught myself actually a lot lately, kind of balancing on the lateral aspect of my foot and have like
Mm,
standing with my foot in inversion. And I feel like
that's not
that's
good.
no, it's not, but I feel like that's a lot of people that do that. It's
Yeah.
like since I've become aware of myself doing it, I've noticed other people. doing it. Like I've always kind of been aware during gait analysis and watching for gait, but just during normal static positioning, I can't say I've really paid attention to it before, but I have noticed it a lot.
Yeah. I mean, we are made to spend more time on the outside, right, because of the arch that's there, but we're supposed to have it even across the metatarsal heads or across the
The bones of the foot.
yeah, sole. My God.
Oh,
Woo. For the foot, and then the side, and then even on the heel. But yeah, you're right. A lot of people will do this instead of sit here where it's across the right part of the feet.
yeah, it's a thing.
So lateral ankle on the outsides of the ankle a lot, which you see a lot of swelling and residual edema in and around the same areas.
Yeah.
I find the lev scap rhomboid minor, that
Oh,
little
yeah.
area there, oh, that's the worst. It's always the worst. Everybody's always like, "What's that crunching sound?" And I'm like,
Well,
"Oh, well, honey, this is something you're never going to get rid of. I'm so sorry, but we can make it more pliable and movable for you." It's like a constant conversation I'm having with people. They're going, "What do you mean? How did I get scar tissue there?" I'm like, "Well, you hold everything up like this, but then you forward head posture." So you're literally overstressing this, and it's not pulling here; it's pulling at the insertion point
yep.
for a left scap, and it's not pulling along your spine; it's pulling along your scapula, your shoulder blade for rhomboid.
Yeah.
That those tendons are the weaker tendon.
Very much so.
Yeah.
And I wonder, like, have you noticed like an increase in that since
Since
like
I
the
started, yeah,
yeah, and even just like with since like the lifestyles have changed and shifted, like with the phones being just giant computers now, they're not just flip phones. Yeah, all the time. All the time. And then even with like the shift, just since COVID, the shift with more virtual learning.
yeah, a lot of people are head down, right? I mean, reading books wasn't much different.
No,
So it
that's
had already started going that direction. Like it's been going that direction for ages. I remember in school them trying to get us to have our posture, but when I was in school, I was hunched down writing notes
all the time. Yep.
all the
That's
time, right? And that was elementary school, that was high school, that was college, everything. So
mhm.
we've been moving in that direction for decades upon decades,
Yeah.
right? But I mean, depending on what your belief system is, chances are that's how we started too,
Yeah, fair enough.
right?
Fair enough.
It's just we don't have the same musculature that we would have
I
had
bet.
we start like if that is the truth and we started like that. Our muscular has changed, but that primitive side still wants to pull everything inward. Do you ever have the where you're feeling the pain is probably the place you need to strengthen, and actually I need to go and treat the opposite side conversation a lot
All the time.
because of scar tissue?
Yeah, all the time. Like, I have a couple clients that have like chronic low back, and the SI is always subluxed every single time. And they're like, I need you to treat my low back and my glutes, my low back and my glutes, my low back and my glutes. And it's like, well, can we come into the hip? Can we come into the front of the leg?
Yeah.
Like, why at the front? And then I go into like my tug of war spiel with the pelvis and the muscles and how it just gets caught in this giant tug of war. And the front usually wins. And then you feel it in the back.
Yep.
I'm like, oh. And then we'll get in there, and then all of a sudden we'll get into the adductors, and they're like, I didn't even know that that was a problem. But then all of
So
a
funny. That phrase right there is like I didn't even know it was sore there. I'm like, yes, because it's shortened. You're not going to feel the soreness in the shortened area. You're going to feel it in the lengthened, taut, pulled area.
because that's where most of the stress is. Yeah, like I have one client that always jokes. It's like, yeah, I pay you to hurt me. It's like, well,
Yes.
if you do the stretches like I told you to, it wouldn't hurt so bad.
Yeah. I have one beautiful, wonderful, lovely client. I see her every 2 or 3 months or so. She needs to come in more often to get her back to like maintenance standard for her body, but she actually does her stretches in between, so I'm not starting at zero every time.
Oh, that's a win.
Oh my god, I'm so happy. I just got to see her last week, and mwah, I was you're the best. You are the best. Thank you so much. All of you who ever watch this and are clients of massage therapists and you actually do the home care, we love you so much.
And your body does too.
Well, yeah, your body does too, for sure. But if you're trying to win at massage therapy, that's how you do it.
Yeah, 100%.
Because, you can win at massage therapy, apparently.
You're gonna win at everything. It's mindset, right? Progress is
Oh,
winning.
so funny. Progress is winning. And oh my God, when you take responsibility for your body, we're going to help you no matter what. Even when you don't necessarily need us for those things anymore, you can still come and see us and just get relaxed. We'll be there for you no matter what. But when you do your home care and we make progress, it's the most lovely, wonderful, amazing thing. It's one of the reasons I love my job so much.
It's yeah, I love it. And like another thing too is like the awareness that comes with our job, right? Like the awareness, because like people don't know, and you don't know what you don't know, and if you don't know, you don't know what to ask.
Yeah.
So I feel like when it comes to scar tissue conversations, it is really important to just communicate how it's working, what's happening, and things like tendonitis. Like that's actually that is scar tissue. That's all. It's micro tears, and then the collagen fibers are going to come in, lay it down haphazardly for stability, and then you're going to continue using it, so it's going to break. And so each time the body's going to come in, what can I put in that's stronger? And then it just lays it down, lays it down, lays it down, lays it down. And then all of a sudden, you don't have that stretch anymore because it is all scar tissue.
Mm-hmm.
All of it is. So that's when you run the risk of ruptures.
Yep.
And I don't feel like people really understand that tendonitis can actually lead to a rupture because it becomes fragile to a point. Like it's strong, but it's still fragile in the same sense that a rope is.
Yep.
Once you get a fray, that's it. It's only a matter of time before that rope is going to snap.
Thankfully, however, in our bodies, connective tissue and scar tissue is recreated consistently.
Consistently, it is,
Yep.
but it also has to be aligned. And that's where massage comes into play, is
There it
aligning
is.
that scar tissue and the stretching and the strengthening. All of those activities that you're given
Mm-hmm.
are to align that scar tissue to make it stronger, because it's going to be stronger and more effective if it's actually along the fibers and the lines of stress.
Yeah.
Just laid down like a patch.
And not every muscle is just a straight up and down muscle where the pull is one direction. No, no. Most muscles, the pull is in 2 or 3 different directions.
Yep. It all depends on where they run.
Yep. I have noticed over the years that you'll find the most scar tissue at tendinous junctions, like where the muscle and tendon where the muscle is ending and the tendon is fully taking over. But you do still find little pockets of that inside of muscle tissue. Have you seen that or noticed that? Where
I
you find
have.
little pockets of scar tissue inside the muscle?
Yeah. Like I see that a lot in like in the biceps and the hamstrings and the quads.
Yeah.
And lats, actually. I see that a lot in lats too.
I haven't seen it much in the lats and the muscle, but I mean the connection at the SI, yeah.
Yeah. Like kind of where it like starts to branch off like mid thoracic region, especially
Yeah.
if they're prone to subluxed ribs and stuff like and yeah. Swimmers.
Oh, poor swimmers. Uh,
Beautiful lats though.
Yeah, they
Beautiful
do.
nuts.
When you are, wow, just the most beautiful lads.
The
I
lots
have
are
this
my
one
favorite.
client, all up and down the mid-thoracic region of their erector spinae at the junction point where longissimus and spinalis, in that groove in between the two of them,
Oh, I agree. Oh, okay, yep.
all the way in that mid-thoracic region, they'll just be crunch, 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 crunch,
Oh,
crunch,
yeah.
crunch. Oh my gosh. I'm like, what the heck? It's all the little tendons in there have a little bit of scar tissue
Well,
from
yeah.
the constant
Bending it forward. Yeah.
bending forward.
Yeah.
Whew, pretty intense stuff, you guys.
It's
So yeah,
fascinating.
if you,
It is really cool.
it is. It's so fascinating.
Yeah. So,
When,
oh,
sorry, no, go ahead.
what's your favorite technique to utilize on scar tissue?
Depends on the location, honestly. I love a hot stone with a little bit of friction
Oh, yeah.
because the heat and scar tissue loves heat.
Yes.
Loves it. It will melt. It won't actually melt, but it's like adding hot water to the hard denim. It softens the denim, right? It's literally bringing more blood flow to the area, which can remove stuff that might be trapped inside of all of that, those fibers that have no good water flow, right? That's, oh God, we haven't even talked about water flow. Oh my gosh.
So
So
many factors.
so many factors, right? Normal connective tissue, and even like normal connective tissue has water flowing in between it. It's what we call the ground substance. It's water, it's minerals, and then it's got fibers that interconnect. Like weaves. I can't. Why can't I weave my fingers today? Weaves. Yeah. Right. It weaves. It's like weaving a basket. Very much like a basket weave. It's so beautiful. Um, let me know, or you can unhide yourself uh, when it's time. Sorry, little ones, of course. Where was I? Oh, right. So uh, our wonderful connective tissue always has fluid moving between, and it makes sure that uh, the fibers don't get super stuck to each other. That they only get stuck at a couple of places where they're supposed to keep wonderful tension but elasticity. Scar tissue doesn't have as much water, right? I actually don't know what the ratio is, water in scar tissue to water in normal connective tissue, or any of the different kinds of connective tissue, but I do know that it is much less.
Because it's dense, right? Because
Yeah,
there's not enough space, as much space between the different fibers.
yeah. There's just a lot of fibers that are being laid down. But if you add heat, heat brings blood flow to the area and allows for more water to try and pass through. Right? It brings blood flow, which means that you're going to have more exchange happening at the capillaries, which is going to get more water to leave the capillaries to flush that area out and hopefully bring it back into the capillaries or into the lymph side.
Heat is an amazing tool.
It really is. So if you're like me and run hot, I'm so sorry. But heat is an amazing tool to use. It's one of those things, whenever I find somebody who has just so much scar tissue in there, I'm like, please, every day put heat on there. Every single day. Stretch it a little bit, put heat on there. Here are your strengthening exercises to get the muscle to the point where you're not over lengthening it anymore.
Yeah. See, I always encourage like the heat and then stretch while you're heating. Well, the heat's there. So like
Mhm.
heat stretch at the same time. That's something that
Amazing.
I, because then it seems like less work then.
Yeah, it is.
Like you're still doing the same amount. Like it's just less time, I guess. It would be less time.
Yeah, you get more results, more
Yeah.
lasting results for sure. Oh, scar tissue. I love working with scar tissue.
Yeah, it's really interesting how it works though. Like, have you noticed people with like abdominal surgery? Have you noticed that you feel more of the restrictions in the back?
I don't have a lot of abdominal
Oh,
surgery clients. I never have.
oh, I see.
I never have, believe it or not. I got a lot of hip. I got a lot of knee. So many knee. I get a lot of breast,
Oh, okay. So
but
then,
not a lot of abdominal.
oh, okay,
Yeah.
fair enough. Because that's something I have noticed. I have quite a few clients that have had cesareans.
Mm-hmm.
Not quite abdominal, but and I've noticed,
Abdominal pelvic.
yeah, I've noticed that they are almost always, myself included, almost always SI problems, almost always that like that restricted thoracolumbar fascia, which is pretty common with everybody, but and then also they're more prone to that more extreme pelvic tilt. I've noticed.
Oh, yeah, that makes sense.
I've noticed.
Especially if that scar got a lot of fatty tissue embedded into it,
Hmm.
right? Those lipid scars those are hard to deal with, man. And I've heard that cesareans have a lot of those lipid scars.
Well, it can be. It's nine. Like you get 9 layers of stitches with a cesarean, so
Yeah,
there's a lot. It's a lot.
that is crazy. That is absolutely awesome.
Yeah, that's one thing I've
Oh,
really noticed is, and then even like people who've had like, um, oh my, oh, appendect, oh my god,
appendectomies?
appendect. Thank you, Chelsea.
You're welcome.
9:30 in the morning. Sorry, my brain's still catching up. My
Yep.
coffee's just starting to work. I've noticed there's been like more more restriction on the lateral aspect on that side.
Yeah. Whenever I get someone who has a tilt on one side more than the other side, I immediately go to the adductors now.
Oh yeah.
It's like it's just an immediate. Oh, update on my knee client, my one knee client that didn't do the PT the first or second round and is now doing PT.
Okay. Yep.
Um, we found we've released a lot of the restriction at the top point in the quad region, but going down underneath the knee, it's actually at like the main issue right now is actually at the pezanserine.
Oh yeah. That's a big one.
It's taken us months to get to the point where we could actually get there. Like it took us a month or two just to get to below the knee without her literally jumping off the table in pain. So we finally got there, and now we've gotten to that point. So everything else is like, yeah, that's tender. It's pulling. It's good. It's not awful. And then we get there, and she's almost jumping off the table. But yeah, Pez and Serene, and I followed the tendon up, and it was for sartorius.
Wow. That's
So
fun.
PT has got her to 90 degrees flexion, and I'm thinking with sartorius being an inhibitor to her movement, we've finally found the place to focus.
That's so good. I
I'm
love
really
it.
hoping.
Well, and the Pezan Serene is one underrated um, attachment that
Oh yeah,
is a huge contributor to almost all the knee issues. Like almost every meniscal injury, PCL, ACL injury that I have, Pezan Serene is the one that's actually really grumpy
yeah.
because it's going to be stabilizing.
That whole those three muscles coming together and forming there. That's a whole stabilizing area for the medial, and the medial is what gets pushed all the time.
Hmm.
Yeah, it's been a lot of fun. There's definitely some scar tissue. Like she's just full of scar tissue all around the knee. We haven't even flipped and done the back of the knee yet. We're still just working on the front.
It's a marathon. It's not a
It
race.
is. It's definitely a marathon, and oh my gosh, I love it. She also loves it, but hates it.
Yeah.
She's a nurse
Bittersweet.
too,
Oh,
so she's just like, I'm gonna take all the pain that I possibly can now because I didn't do it when I should have.
And that makes it worse, right? Like that's just a shout out there. The sooner you can get it addressed, the
The better.
quicker your recovery time is going to be.
Yeah. And not just because of the scar tissue, but because of the pain circuit inside of your brain that has a story. And that story is you go here and I'm going to fire a lot. I'm going to fire that circuit of pain because I know that this area is pain. Even just normal touch is going to now be so called as pain,
Mm.
right? So it's both. If you get it early, you don't have as fortified a circuit. Oh,
Yeah, it's crazy.
I'm really looking forward to today for getting into work today because I've got some fun clients at the beginning of my day.
Winning.
Yeah, one of my regulars has finally convinced their partner to come in. They've been, you know, yeah. What's I can't remember. I lose words.
It's a thing. It's early, man. It's early. No
Um,
judgment on my end.
yeah, but yeah, pushing back. They've been really pushing back and being like, I don't want to go to the side. I don't know. I don't know. And she's just like, dude, you hurt all over. Go get a massage. So I'm very excited.
It's her
Very excited.
husband. That's
Her
that.
partner, yeah.
Yeah. Um. Yeah. It's just kind of interesting how I find that a lot more with men specifically, where they're like, no, I don't need to, and I don't know if it's just the social pressure that they have to be strong and
Possibly.
resilient. So that's a sign of weakness. Or because
Because
I
they're not
noticed it
used
a
to
lot with
touch.
because yeah, or the touch even. Like it's not weak. I didn't it's not weak to go get a massage. Like it's not weak to go take care of yourself. That's not a sign of weakness. Do not that's yeah,
That's
it's
not
not a
what you
sign.
were saying, but a lot of people think that.
Yeah. Um it's but when it's or even just like taking control because like I know with like some of the prominent men in my life, they're I can just plow through it. I can just plow through it. It's okay.
You
It's going to
sure
work itself
can
out.
until
It's
you
going to work
can't.
itself out. And then all of a sudden you have a meniscal injury.
Or you
And
have
then
ribs pop out.
you have you just call me out, Chelsea.
Not intentionally, but kind of, I think, subconsciously. That's okay. For me, it's and then you get Achilles tendonitis.
It's
That's what
okay.
I'm dealing with right now. So I want to give you the fingers so bad right now. No, I'm just kidding. Uh, oh wait, what is it?
Yeah. I forgot all about yes.
Oh yeah, you're kind of dumb.
Love that.
But yeah, like you're right. I've found that with a lot of people. I've had a number of my clients bring their partners in for a couples massage so that they could be in the same room and be more comfortable about it. And now they've become regulars with the other massage therapist that's there,
Yeah. And
right? And
that's
I'm just like, this is amazing. Like, yeah, let's do it.
yeah, and that's usually what it comes down to, right? Is just that experiencing it, and then it's like, oh yeah, okay, this isn't what I thought it was going to be, and then or there are actual benefits to this,
Yeah,
and then they just kind of become the most loyal once they actually come in. They're
hmm
yours.
they do. They do actually come extremely. But that's the thing with anybody who comes in for a massage and finds the benefit.
Yeah,
Right? They feel the benefit of it, and it's like, yeah, I want to do this, even if you can only do it once every year, once every 6 or 3 months. Right? I've got moms who book 3 or 4 months in advance because that's how much time they need to make sure they can come.
yeah, I feel
Right?
that.
Which never feel bad about that. Please never feel bad about that ever.
Like I always tell my clients, it's better to have the appointment and cancel if you have to, preferably with notice. Please give notice. Please don't
Always
do
with
last
notice,
minute
please.
cancellations, but it's better to have that appointment and cancel if you need to than to need the appointment and not be able to get in.
Yeah.
Like that's one
Right.
thing I always really encourage is like book it now when your schedule shifts. If it shifts, just call as soon as you're aware and we'll work it out.
Yep. I do. I think I have probably 4 or 5 single mothers or mothers who just don't have the time, and that's what we do every single time. I'm like, okay, we're going to book you in for 3 or 4 months ahead, right? You're going to put that in your calendar. You're going to make the plans now for that 3 or 4 months ahead,
Mhm.
so that you are able to come. You are able to. If everything goes to crap, we get it. Things go to crap, but you need to allow yourself to refill your cup.
Yeah. And that's just it, right? Like, and that's something that I feel like a lot of people don't really realize until they're facing like a nervous system burnout.
One of my clients is that right now. We're
Yeah.
trying to get her nervous system back on track.
Well, I had a
Also, so many trigger points. Oh, it's so
well,
much
it's a
fun.
thing because you're holding yourself, right? When you're like, once you hit that burnout, everything is just overstimulating. Conversations, talks, touching, anything is just overstimulating. You're just like,
Overstimulated.
oh, and you're constantly in that agitation. So there's that constant
Oh yeah.
tension held where trigger points are gonna be like, hey, this is a good environment for me.
Oh yeah. And I will tell you, the past like 5 months or so here, the amount of tension and trigger points that I've been finding has escalated
Mm.
with everything going on, specifically with America right now. Escalation in the tension, in the inability to let go, in the sitting there and having arguments with people in your head while I'm trying to get you into a relaxed state. It's been escalating.
Yeah, I've been noticing that quite a well, not for that reason, but I've been noticing like I feel like I don't know, I think something's happening in space.
Hmm.
I always blame space. Like honestly, something's
I'm,
happening in
I'm
space.
gonna I'm gonna blame world leaders.
Oh, there's that too, but I've noticed like for like a lot of my clients, they are like things that they thought were buried are just coming back to iron glove slap them.
Ugh.
Like, you know, they're
Yeah.
having to be forced to deal with things that they didn't want to before. And like that's a pattern that I've noticed over the course of the last month
Hmm.
is just and even in myself, in my daily interactions, like there are life events that are surfacing that are almost forcing reflection or forcing that resolve.
Yeah. You know what? I
So,
believe that.
so that's where I was
Kind
like,
of do.
that's where I blame space. I always blame it's a retrograde of some sort.
Blame me. Well, my dear, I gotta start getting ready for work.
Yeah, I gotta get ready to go race our cup cars today.
Yay, cup cars! Not cup, cub.
Cup
For people
cars.
who are listening.
C-U-P. Yeah.
Yeah. All right.
Hopefully,
Well, it
hopefully
was
we
lovely. Anybody who joined, thank you so much. And anybody who's watching this later, I hope you enjoy. And we will talk.